My name's Carol Stott. I've been practicing as a stomal therapy nurse for over 30 years. I work at Prince of Wales Hospital, which is one of the large teaching hospitals in Sydney. And I still very much enjoy my role after all these years. Well, when I'm actually called to see a patient, and most of the elective patients I see in the pre-admission clinic, and one of the first things I say to people is, look, nobody wants to have a stoma. If you turned around to me and said, oh, I'm looking forward to having this, I would think you were a bit mad. So this is, a stoma is usually performed to save your life, and we all understand that. My role is to make it as easy and as pleasant as possible. And I know, for example, you've got a 90% or so on chance of having a stoma. You're still going to hope that you don't have it. But obviously, I'm going to have to talk you through having a stoma and what to expect from that. Well, patients struggle with things like intimacy. If they haven't got that good a relationship with their partner, this is a big fear for them, having a stoma. They think that they're going to smell, that they're going to have leakage problems, all of these things. So I try to reassure them right from the start that if they listen to the teaching we give them and follow the instructions, there should be no leakage problems, there should be no smell, and there should be no sore skin. Most of the patients I've seen, the elective patients, they've seen photographs of a stoma. And so they usually look at the stoma and manage to cope reasonably well. The problems arise with people who've had emergency surgery, and obviously that can occur in the middle of the night. So they've been very sick often. I've got a patient currently at the moment who's not even 40 yet. She was in intensive care for about 3 weeks. She was so sick. So the first time she looked at her stoma, she got very upset. So we'll work with her to get around how she's feeling, and hopefully in the next couple of weeks she'll start feeling as if she can cope a little bit better. Well, we're currently following patients up by doing a research study, and we're looking at how people adjust to having a stoma with time. And we're finding that over time people do adjust and do come to terms with having a stoma. And we are actually finding no difference in adjustment between temporary and permanent stomas. Yeah. I think at our hospital everybody sees a stoma nurse, and the majority of people see them pre-op and then they're followed up post-operatively. I know that there are areas in New South Wales and Australia where there are no stoma nurses employed. I've actually been in contact with patients from those areas, and they really do struggle. And I think that's a great shame, and I think it should be a priority by the government or the powers that be that stoma nurses are employed in all areas of New South Wales and Australia.